Good morning, everyone. This is Patsy-An Low. I am the Chief of Staff and Policy Advisor for AVPN, and I'd like to warmly welcome all of you to today's webinar on Financing Solutions for Social Protection in COVID-19 Response and Recovery. This is the first of a series of webinars that will be offered in partnership between AVPN and UNDP. We're glad to see you online with us today. The COVID-19 pandemic has posed major global development challenges affecting the lives of millions of people around the world, with very critical implications to not only health, but also social, economic, and even political arenas. So while social protection programs have been a crucial part of the COVID-19 response, this pandemic raises a need and an opportunity for new and innovative ways to provide social assistance so that we can rebuild communities to be resilient through this crisis and beyond. So in this session today, we will be hearing from speakers in Indonesia, Philippines, India, and also from UNDP, who will share their unique experiences and approaches in leveraging innovative financing mechanisms and ways of collaborating with cross-sectoral stakeholders to reimagine social protection for vulnerable communities all around. Some housekeeping reminders before we begin the session. For those of you who have already been regularly logging on to AVPN's webinars, I ask for your patience while we share the housekeeping instructions with the new participants. You will see at the bottom of your screen that there is a Q&A chat box. It will be open throughout today's session. In the Q&A box, you are highly encouraged to leave behind questions for the speakers. You can also view and upvote participants' questions that you think are of interest to you as well. The moderator will be raising questions to the panelists to answer, and we ask your understanding that in the interest of time, we may not be able to address all questions that have been raised. The session today will be recorded by AVPN. The recording, as well as any other relevant resources from the speakers, will be uploaded on AVPN's website after the webinar, and we will be sharing the link with you at the end of this session. We ask for your understanding that while the session is ongoing, the chat box for interaction between the participants will be disabled so that we can invite your full attention to what the panelists are sharing. However, we do invite that if you've got questions to please put them into the Q&A box, excuse me, at the bottom of the screen. Now, without further ado, let me briefly introduce our session and our speakers today, and then we will begin the session proper. Today's session will be approximately 60 minutes, and we will get to hear individually from each speaker, followed by a moderated Q&A session and a panelist discussion with our speakers. Kicking this off will be firstly Dr. Shagun Sabharwal, Director of Policy, Training and Communications at JPEL South Asia, followed by Ms. Gisela Tiongson, Executive Director of Jollibee Group Foundation, and then Mr. Hidayat Amir, Director for the Center of Macroeconomic Policy at the Ministry of Finance, Indonesia, and then lastly, Mr. Balas Horvath, Regional Senior Economist at UNDP Asia Pacific. Today's session will be moderated by Ms. Joanne Manda, Regional Advisor for Climate Change and Innovative Financing at UNDP. So now, without further ado, I would like to hand over the floor to Joanne, who will be the moderator for our session today. Joanne, please begin.
Thank you very much, Patsy-An, and hello, good morning, good afternoon, maybe even good evening to some of you who are joining us this morning. We're very pleased that you could be with us. My name is Joanne Manda, as Patsy-An said. I'm the Regional Advisor in UNDP. And I spend my time between the regional office in Bangkok and the Innovative Finance Lab in Jakarta, Indonesia. UNDP has been expanding its footprint and portfolio around innovative finance for the SDGs, looking at different ways to leverage private investment into SDG outcomes. And there's a growing portfolio of exciting work here in Indonesia around impact investments, debt and risk financing, public financial management, Islamic finance, and philanthropic support towards the SDGs. I'm very pleased to be here this morning because having the partnership with AVPN is one of the ways that UNDP has been recognizing the need to create platforms for government and private sector to come together and to discuss the great needs that we have in terms of financing the SDGs. And so this public and private partnership is one that we really are excited about. And today, as we said, this is the first in a series of webinars focused on financing, the financing aspects of the COVID-19 response and recovery. And we all know that the coronavirus outbreak has been a global pandemic, and it has posed major global development challenges. It's affected billions of people around the world, and the contagion continues to expand, and countries are already experiencing second waves and so on. And it's not only a health crisis, it's also a social, economic, and even a political crisis. And it's been of unprecedented proportions, and having a growing impact on domestic and global economies. So it's a real pleasure to be here this morning. I'm joined by a panel of exciting speakers who will talk us through some of the responses to COVID, with a particular focus this morning on how many countries have been developing and expanding their social protection programs and packages in response to the global pandemic. So I'm going to turn to our first speaker, Dr. Shagun Sabharwal, as the Director of Policy, Training and Communications at JPAL in South Asia. We know that JPAL is a think tank and with the mission of mobilizing evidence to improve policy making. Can you tell us a little bit about your support to the government of Punjab and others in relation to their COVID response? And also maybe give some reflections on the lessons you are learning in terms of the social protection response and the policy implications for that. Over to you, Dr. Shagun.
Thank you very much, Joanne, and thank you to the organizers for organizing this really exciting panel discussion today. So Joanne, in answer to your questions, I have a few slides which I would like to quickly share. And as Joanne has mentioned, the focus of my presentation is going to be on looking at sort of what are some of the key challenges that are emerging as a response to the pandemic that have implications for the design features of social protection systems, and what are some of the recommendations that we can think about from an evidence lens. So without further ado, let me quickly start with my slides. So first, just to put a context, and as Joanna said, COVID-19 is a prolonged public health crisis. And what I want to emphasize here is the word prolonged, because it is really constantly evolving in nature. And there's a lot of dynamism in, even from a public health lens, the manner in which this pandemic is spreading. So, and this then has direct implications in the way governments and other important stakeholders are able to respond to it, right? So thinking about, say, the lockdown phase as being very different in terms of what the social protection system needs to do versus when the countries are not in a lockdown mode. This has, of course, come with a heavy cost to the economy, and similar to India, I'm sure there are many other countries that are facing a very, very challenging future ahead. But here I also wanted to mention that over and above the macroeconomic pictures that we see, it's also important to acknowledge that governments are also facing a sort of a double whammy, because on the one hand, their revenue streams are drying up because decreased demand in the overall economy. And on the other hand, the demand for providing social assistance, expanding their safety nets is really at its peak right now. And finally, the human face of this, all of this, is the fact that in countries like India, where there are many deep-seated inequalities, and I have to stop here and say, because while India has progressed economically a lot over the past decade or so, we have research that shows that the benefits of this economic growth have really accrued to only a very few proportion of the population, which means that there are still many, many people who are extremely vulnerable. And this particular pandemic is really going to push them further into economic shock. But at the same time, it's also important to acknowledge that this has led to the emergence of sort of those who were previously not sort of your traditionally poor people. they are going through a lot of job loss, income shock, and we need to cater to their needs as well. I would like to here also talk about what has really emerged as for us as a particular group, that the system was constantly failing, the current social protection system, and this is the group of urban migrants. So just again to give the context, India has about 100 million internal migrants, and they really move from rural areas to cities to find work. But the nature of this migration is sort of temporary in nature. Sometimes it's seasonal, the families are back home. And basically when they're in the cities, they really don't have any formal mechanisms that allow them to access the social protection systems that exist on the government side. So as a result of this, I think it is really important for us to redesign and rethink our social protection systems that it can meet the unique needs of these urban migrants. Now, going back to the question on what has been the government's response, of course, the government announced this big package. And here again, it's really important to understand the importance of governments investing in a social protection architecture or a social protection system before the COVID happened, and how this can really be used during the crisis time. So India, for us, during the pre-COVID times, successive governments had worked and spent a lot of money in laying out this foundation, whether it is to increase the reach of these programs, whether it's to announce new programs, or it is to really set up this infrastructure for government to person payments, whether it's direct benefit transfers or thinking about unique identification cards and so on and so forth. So very quickly when the crisis hit, the government was able to use these platforms and programs to sort of really push a lot of these benefits to different people. At the same time, they also undertook some liquidity measures. They also announced a big relief package. And then in terms of the financing of this, traditionally the social protection schemes are publicly financed. But during the crisis, we really saw a lot of partnerships happening. So the Prime Minister of India started this charitable trust, which led to a lot of people giving in money here. Religious and spiritual organizations have also channeled funds, and there have also been crowdfunding platforms that have really raised a lot of money specifically for the COVID-19 response. So now, while all of this has been great, there are some really critical gaps, like I mentioned, that are really emerging for us that have design implications. So the first that we are seeing is that the social protection in India has been skewed towards rural areas, which has left a lot of the urban households vulnerable. We also find that 85% of the labor force in India is informal, which is a barrier to effective distribution, right? And there is just no way for governments to reach these people. There's no formal database of these people. Thirdly, the benefits of a person is really tied to his or her place of residence. And for this, the government has already changed the design to have portability of benefits, especially in people's ability to access the food distribution network that the government has. So now there is a one nation, one card, which allows people to use that card in any fair price shop across the India, which was not the case before the pandemic hit. And finally, for us, there is this big challenge of how to reach those who don't have identification cards and how to get them into the system. So I would like to end with my final slide by talking a little bit about the insights that we can draw upon from the evidence that JPAL-affiliated researchers have been gathering for many years now. So the first challenge is, of course, around targeting that I've already mentioned. So even in the existing schemes that we have, there are some exclusion errors. So the people that we most want to reach out to, we are not able to reach out. And typically, there are methods such as proxy means tests, etc., that are used for targeting. Those are more longer-term measures of a person's poverty. Right now, there is a need to think about more flexible and dynamic systems, thinking about self-targeting, thinking about community-based targeting. And two of our economists have done a lot of work in Indonesia, shows the importance of this type of targeting. There's also a lot of conversation around universal transfers. And while UBI is one end of the spectrum, there are economists who are also talking about income transfers that may be pegged at, say, 1% of a country's GDP. Finally, I would like to end by saying that there is a need for newer forms of social protection, and housing is one of the key social protection mechanisms, where there's a lot of demand now for thinking about rental housing for migrant workers, for example. And I would like to end by talking about digitization, where this is a huge opportunity for thinking about contactless payments, for really moving into a digital system. But our research also shows that really the devil is in the details. And if you do not answer a lot of these detail level questions and set up a system that may become, may have exclusion as a problem, then you may again have a huge issue. So while we're thinking about digitization, it's really important to also bring in community organizations, also having a lot of partnerships with social entrepreneurs, innovators, and corporates. So I would like to end here, Joanne, and over to you. Thank you so much.
No, thank you very much, Dr. Shagun. And you've covered a vast array of issues there very rapidly. But, you know, you've highlighted some crucial points, and particularly your final point on digitization and how that might be, you know, an important area for growth going forward, especially given the vast changes in how we do business because of COVID and because, you know, mobility is now becoming a challenge. So this contactless payment systems and so on are crucial. I think you also highlighted very nicely, you know, just the way in which we need to rethink the targeting of our social protection programs and how we can leverage, you know, private innovation and private, you know, responses, because of course, government can't do it by itself. We will loop back to you, Dr. Shagun, and I've got some definitely, but in the interest of making sure that we get the full picture, I'm going to move on to Gisela Tiongson, who is the Executive Director at Jollibee Group Foundation in the Philippines. We know that you have been doing quite a bit of work, Gisela, in terms of the COVID response in the Philippines. Could you tell us a little bit more about this?
Yeah, thank you, Joanne. Good morning, and thank you to the AVPN and UNDP for organizing this webinar. A lot of the things that Shagun mentioned actually has some parallels in the Philippines, but this morning, I would like to share how the private sector in the country has undertaken various initiatives to support the government's efforts in saving lives and livelihood. And let me start by sharing what we at the Jollibee Group have done in the past months. As a background, Jollibee Foods Corporation, or JFC, is one of the fastest growing Asian restaurant companies in the world. And beyond Asia, we operate restaurants in North America, Middle East, and Europe. And Jollibee set up the Jollibee Group Foundation to engage with communities in a strategic and sustainable manner. We implement programs in education, agriculture, and disaster response, where we harness not just the financial resources that the company annually donates, but also its intrinsic expertise as a food company. For example, the Farmer Entrepreneurship Program builds the capacity of smallholder farmers to make them part of JFC's supply chain as direct suppliers. And under disaster response, we have Jollibee Group Food Aid, where we donate spice mix congee spice mix developed by JFC. The congee mix is deployed to local government partners ahead of time, so it can be part of their disaster response, providing hot meals when calamities strike. When the Philippine government declared community quarantine in March, we immediately donated ready-to-eat meals to medical frontliners nationwide. This was followed by food assistance to urban poor families in Metro Manila and nearby provinces. And to date, Jollibee Group has donated $4.4 million US. Providing assistance to communities during this period posed a unique challenge. People have their houses and possessions intact, yet they are restrained from freely moving around. Neither can they congregate in one area to receive whatever donation is available. So we decided that the best option will be to provide ready-to-cook marinated chicken so families can cook their own meals, but distributed directly to their homes while observing physical distancing. And so we are grateful to the more than 70 community-based partners who helped us distribute to the most vulnerable families. We were also joined by supplier companies of Jollibee and other corporate foundations that contributed an additional $1 million worth of cash and in-kind donations. Donation coin banks normally placed on the counters of the JFC restaurants were migrated to the digital space to encourage donations from the public. And altogether, the combined efforts of JFC, JGF, and its partners benefited almost more than 500,000 families or 3.5 million individuals nationwide. Our effort, Jollibee Group Food Aid, is actually part of a bigger business community initiative called Project Ugnayan, or Coming Together Project. It aggregated the efforts of 200 plus companies and raised a total of $20 million. The amount was used to buy gift certificates from supermarkets, which were distributed through the Catholic Church's network of parishes at a $20 gift certificate per family. Another innovative collaboration was between the business, NGOs, and the entertainment industry called Bayanihan Musikahan, or Collective Action Through Music. Online concerts by well-known singers raised a total of $2.6 million from companies and ordinary citizens here and abroad, and the amount was used to distribute food items and support livelihood projects. By April, these different groups started to discuss how to best maximize the resources to meet the needs of communities for the long haul. And three things came out of that collaboration. First, areas that are most in need that have not received adequate assistance were identified through a technology-assisted community monitoring system. Second, we met as a coalition with the government's Department of Social Welfare and Development and helped them develop a playbook for crisis communication. And finally, the coalition did a collective sense-making and identified health and livelihood to be the continuing areas of assistance in addressing the impact of COVID-19 to urban poor communities. One of the projects we are now prototyping helps restore the livelihoods in the communities while providing meal assistance to the most vulnerable. A microfinance institution has mobilized its clients operating small eateries to serve tasty and nutritious meals to families with members who are ill or malnourished. A voucher system entitles the beneficiaries with 2 meals per day for 1 month, and thus, for $6,000 or $1 a day, 200 individuals will have meals for 30 days. We later found out that those meals, in fact, became the meal for the whole family. JGF trained the eatery owners on food safety and customer service, once again tapping into the expertise of the company. In addition, Jollibee's R&D group developed a new products that families can easily prepare. This resulted in ready-to-cook meatballs and sautéed chicken, which we donate to communities. We are in discussion with the Department of Agrarian Reform for them to complement our donation with vegetables sourced directly from the farmers. This thrust of providing food assistance to ensure good health while supporting the livelihoods of micro-entrepreneurs and smallholder farmers are the pillars of the Jollibee Group's response to the impact of COVID-19. In doing this, we hope to not only reduce hunger, but to also keep the enterprising poor from sliding deeper into poverty. Thank you.
Thank you so much, Gisela. That's such an inspiring set of actions and an inspiring body of work that you've shared with us there. And it's really great to see how private sector is, dynamically responding to the COVID-19 crisis, innovating, and really getting stuck into the recovery initiative. I liked how you've highlighted also the technology aspects of the work that you're doing, making sure that you're using technology for community monitoring,
right,
so on. And Dr. Shagun has already started, I think this is a theme that's starting to come through as well. And also, I think maybe tapping into the entrepreneurial spirit of citizens and so on. So thank you so much for that. Just to remind the participants, please feel free to put questions into the Q&A box as we are going through. I'm going to move on for now to the intervention from Pak Amir Hidayat. who is the director of the Center of Macroeconomic Policy in the Ministry of Finance here in Indonesia. Pak Amir, we know that the government of Indonesia has been taking robust measures to respond to COVID-19 and is investing heavily in social protection programs. So can you tell us a little bit more about this? Over to you.
Okay.
Yeah.
Good morning. Thank you, Joan. I have several slides here, but basically I will respond to your question. Distinguished participant, I'm glad to be one of the panelists in this webinar. First of all, I would like to thank AVPN and UNDP to make this webinar happen today. Talking about Indonesia, basically we can see a nation in progress of development. You can see that maybe in the next slides. You can see now Indonesia is a part of middle income countries. And of course, talking about Indonesia, we are talking about the fourth biggest population in the world, the countries with a huge population and with young age population. So basically, we have very good potential, and we have to underline our country also under a reform agenda. So many structural agendas to pursue the Indonesia become high income countries before 2045. And we look at here, this is our opportunity, our trajectory to become a high income countries. Basically, we have a huge potential on rising the middle class. This is a potential in the demand side and also in the supply side. But again, in the near decades, we will face the demographic will shift to be aging population. We still have low productivity. This is the challenge. And almost half aspiring middle class already there. And we're trying to push further on the rising middle class. But now we're facing COVID-19 at the global pandemic. So this is crucial to increase productivity in the medium long, improve welfare, and anticipate the aging population. Next. Next slide, please. Unfortunately, Indonesia is in the early stage of development social protection system. We already have social protection, contributory, non-contributory, and other programs basically on empowerment, micro, small, medium enterprise empowerment. But again, this is not yet as a comprehensive social protection system. We're looking for the reform to improve this one. But again, during the reform, we're facing the COVID-19. Next slide. In 2020, so then because we have a COVID-19 pandemic, the government trying to focus on three things: handling health, COVID-19 issues, and then protecting the poor and vulnerable with social protection program, the existing one, okay. And then in the third one, we're trying to support the businesses, basically to protect them from massive bankruptcy, from keeping the employment still in the job. But again, this is not easy. Basically, we're trying to see that businesses can still in the good position when the COVID-19 ends, so they can jumpstart the business again to the normal business. Next slide. This is I will back to that slide. So the government choose the government regulation number 1 2020 as in lieu of law to give this is emergency situation. So we revised the budget to become more flexible to encounter the COVID-19 problem. So in the revenue side, a bit declining due to the economic activities, but the expenditure side, a bit expanding due to the national economic program. Next slide. Next slide, please. This is the government economic recovery program. Basically, we tackling the health issues and also the social protection, business incentive, corporate financing, and so on. So the social protection itself is about 1/3 of all the national economic recovery program. We will talk a little bit here, the challenge on the social protection during the COVID-19 in Indonesia. Next slide, please. As I mentioned earlier, Indonesia in the early stage of the development of social protection. We just started in the full subsidy reform and translated it to the social assistance by direct subsidy to the household. So we already have a good database on the bottom 40 of the population. We call it unified database for poverty alleviation. We have here conditional cash transfer, basic food card, or we call it sembako, 9 bahan pokok in 9 of a basic need of the household. And because the data itself or the program itself good only for bottom 40. So then the government trying to expand the number of the benefit and also the coverage due to by several others program. Like for example, we activate the electricity discount and also cash transfer, and we use the village fund as a cash transfer, and we use a pre-employment card, Kartu Prakerja, also as a social assistance program. Basically, we facing the challenge because the impact of COVID-19 not only for bottom 40. The informality in the informal sector in Indonesia is quite huge. So not only there, we're trying to respond quickly with the more targeted with some these circumstances. So the government trying the best with PKH, basic cash transfer and so on, but also extending the program. For example, we use cash support expansion and also productive financing for small, medium enterprises, just giving them the money as the working capital for small, micro businesses. And also we giving wage subsidies for the employee that the wage below 5 million rupiahs per month. So this is kind of our social protection at the mid COVID-19. So we'll see that, okay, we have we have so many challenge. We have understanding that during the crisis, we see that, oh, this is not enough. We're trying to reform. We're trying to improve in the near future to reform to accelerate the reform in the social protection system. Next slide. I think this is the last slide. Next slide, please. Yeah, basically we're trying to address on the reform of social protection system in the lower level as a purchasing power cluster. We maintain the livelihood for the poor and the vulnerable person, and also because for some household there are obstacle to access the health and also education. So we provide education and health quality cluster basically to improve the quality of children in Indonesia, so they have a well education and also health services. And also we're trying to closer the gap between the labor market and also the labor force that increasing coming year by year from the population. This is we're trying to move forward to have a more ideal, more comprehensive the social protection. I think Indonesia is good story, good cases for us to see the improvement, the development of the social protection system in the country. I'll stop here, Joan. I'll happy to have another discussion with participants. Thank you very much.
Thank you so much, Pak Amir. There's a lot that you covered there. The government is doing a comprehensive program across the board, touching on SMEs, electricity discounts, using the village funds. I think there's a lot that we can learn from what Indonesia has been doing. And there's one question from the participants, which I just want to quickly ask you, Pak. A very, very short answer. The question is, are the wage subsidies accorded across the country or based on eligible companies or a particular income bracket?
Yeah, as I mentioned earlier,
yeah,
we have a problem on the full package of database. So then we use the BPJS Ketenagakerjaan database, and we're trying to expand for example, for tenaga honorer is a teacher that not already become the government employee, but they teach for.
okay.
So basically, the main challenge is data. So we use the existing data that already have in the BPJ health, not labor insurance, employee insurance company.
All right, okay, that's great to know. And I hope that answers the question. Our last panelist is Balázs Horváth, who is with UNDP. He's our senior economist and a strategic advisor on the Belt and Road Initiative. Balázs, over to you just to race us through. I know we're looking at our time here, but race us through some of your perspectives around the emerging trends on social protection across the region. What are the lessons we're learning, and what are some of the policy considerations? Over to you, Balázs.
Thank you very much, Joan. Let me start by thanking you for the invitation. It's really an honor to participate. So I'll talk a little bit from the regional perspective. I'll talk about the role of basic income type measures and some policy considerations, including how to include the private sector. Can we go to the next slide, please? I'll start with a pretty picture. Basically, just to make the point that poverty, of course, has declined through 2019 throughout Asia, but remains endemic in many developing Asian countries. And you have a couple of examples here with some finer distinction on which particular poverty level, what percentage of the population lives under which particular poverty level. On the right-hand side is a picture which I think is very important to keep in mind. Every time we look at the number of people in certain income quintiles, which are 20% ranges, we see a fair amount of constancy, but that masks the fact that it's really not the same people who from one year to the next are in a certain income quintile. There is a lot of churning, a lot of movement between income quintiles, and that actually makes the task of people like Pak Amir much harder, because it's not the same people from one year to the next. This one comes from Indonesia. It's rather dated, but the fact remains, and actually probably during COVID, the pandemic, it has become even more extensive. Next slide, please. We have written a regional paper, and two things really stand out. One is that the pandemic has revealed that the development path that all Asian countries and in fact most of the world has been on has been unsustainable. And as we build back, we should not aim to build back to exactly the same as we had before, but we need to aim for building back to sustainability in all pillars. That's economic, social, and environmental. The other, specifically on social protection systems, is that in Asia, social protection systems fail to reach a very large number of people who are in vulnerable situation, and also the ones who are falling into poverty. And the key gaps come owing to the very large share of the informal sector and the very limited role that automatic stabilizers play in the fiscal response. The COVID-19 response in social protection actually can be sort of grouped into three groups. Vertical expansion, when the transfer values are increased for existing recipients. Horizontal expansion, when new recipients are brought into the existing schemes. And new types of measures, and they are largely in three groups: universal life cycle type measures, basic income type measures, and insurance-based ones. Next slide, please. I'd like to spend a little bit of time on basic income type measures. And COVID-19 is a very large shock. It's throughout the world. It hits every country, and it's synchronized across countries. So a lot of countries are facing the same problem, and that is, how do we reach people who are not covered with the usual type of social protection schemes? And one way is to provide a cash transfer. There was a Global Policy Network paper which came out very recently. They have used the World Bank's POFCANet data for 132 developing countries. And what they have established is that this is not out of reach. It is actually possible to provide significant cash transfers that will reach a very large part of people who have no support otherwise. This can only be done on a temporary basis if you want this to be fiscally sustainable, but it is certainly doable. Of course, issues remain: how to fund this, how to actually make sure that we reach the excluded populations and there is no double dipping, and to find levels of support which do not substantially erode the incentives to work, save, and invest. Next slide, please. I have two slides on policies. The first point I'd like to make is that there is no single social protection scheme that will address all the problems. It is, in fact, the overall social protection system that needs to be optimized. And optimized meaning it has to reach most of the people who are in need with adequate support. That will be country specific. All countries have different contexts, have different existing schemes, and therefore it is very important to carefully build this up in each country individually. But a basic income type measure is a very useful component for this. Of course, they need adequate fiscal space to do this. And for that, it is just not feasible that every country goes out to the world and borrows huge amounts. And therefore, countries need to have a clear-headed review of their expenditure and revenue policies. What remains optimal in this post-acute phase of the pandemic, and what is no longer optimal? And in a very clear-headed manner, just get rid of those that are no longer optimal. And that creates the fiscal space. One particular aspect that our paper has emphasized was to address what we call fiscal termites, very large drains on budgets, national budgets, and they come from transfer pricing of multinationals, tax havens, tax evasion and avoidance by multinational companies, the untaxed digital economy, and that's just on the revenue side. On the expenditure side, there are white elephant investment projects and fossil fuel subsidies, and all these need to be basically revamped and fossil fuel subsidies eliminated, and that will create fiscal space to do what needs to be done. Of course, this cannot be done on an individual country basis because there is a competition among countries, and therefore this requires international coordination. And the next slide will emphasize this again, but I'd like to emphasize it. We need to crowd in the private sector and civil society. And that can be done through various measures, one of which is to make sure that we work with the private sector to make sure that the informal economy is shrinking. And we have a formal economy that provides a tax base, which then provides the revenues for government to actually support whoever needs to be supported. Of course, government also needs to regulate to address market failures and, as I said, abandon wasteful policies. And in countries where there is conflict, that's the largest termite of all, to make sure that they contain and prevent conflict. I'd like to close with one conclusion that we have found in the COVID-19 pandemic, what we found is that there was a bifurcation. There were people who were just fine. They were able to tap into networks through the internet. They were able to do what we are just doing right now, to connect through the internet and discuss and work digitally from remote locations. And they managed to keep their jobs, they managed to keep their incomes and fared far better than those who couldn't. And a very similar kind of divide opened up between students who were able to continue learning even after schools were closed because of social distancing, and those who couldn't. And the point is that governments need to consider and actually do it to provide affordable internet access, and also the skills for people to participate in the digital, the sharing and circular economies, and to make use of these opportunities of working and learning remotely. Thank you very much. Over to you, Joe.
Thank you so much, Balazs, and you covered quite a lot of issues here. I particularly like your terminology, fiscal termites, and really thinking about how governments can drive efficiencies within their public financial management systems. What are we spending on now that we really, need to rethink, given the amount of recovery and rebuilding that is required? So I really appreciate that point, and I think it's a very salient point for all governments to really start thinking about. I mean, even in the context beyond COVID, but looking at sort of green recovery, keeping abreast of the climate change issues as well, these issues around fiscal termites, and rethinking government expenditures is crucial. I also like your point, and I think this has come through again through all the other speakers, is around this digital divide. The access to online virtual tools and systems is crucial. And going forward, I think government, private sector, everybody really needs to be thinking about how we can create that infrastructure and have everybody be able to access it. So that's absolutely fantastic. Many thanks also to the participants who have been throwing questions at us, and I'm picking a few just to loop back to the panelists. First question I think I'll pick up, and because we're still talking within the fiscal space here, a very quick question to you, Pak Amir, on, to what extent are you doing some medium to long-term planning for financial management, public financial management? Over to you.
Okay, thank you, John. A very good and tough question, actually. Yeah, I will say like this. Indonesia, basically, in the last 5 years, we're trying to consolidate our fiscal. You can see the indicator, the improvement in the primary balance. Negative primary balance has been improving very well. But we're trying to have the accelerate the economic growth, not by extending the deficit, but by doing the structural reform. This is the government commitment during the last 5 years. And for the national medium-term social protection plan, financing plan, actually we just published the long-term fiscal sustainability report. You can find it in the Fiscal Policy Agency website. Unfortunately, this is in Bahasa. But again, because the projection itself is based on the only existing one and the plan of reform. So we have there the scenario for the medium term. Of course, this is still in the highlight because we're trying to push the reform in the social protection. Indonesia maybe is still lagging in the pension system and so on. But the national health insurance already there, the national employment insurance already there. We're trying to push to be more comprehensive in the social protection program. Basically, we're trying to see the better system in here. So I think that's my response, John. We do
thank you.
Your support in this area.
Thank you so much, and sorry to pressure you a bit. We do need to get a few more responses. I'm going to swing to Dr. Shogun and ask you a very quick question. One of the questions that's come up on the panel is around what are the gender implications here? Are we missing some things? And, you know, in terms of your suggestion earlier about, you know, moving towards universal coverage, what does that really mean? So can you say?
Thanks a lot, Joanne. And I think this is a great question. So I would respond to this by first of all saying that in countries such as India, we have to think that the problems are also at the level of intra-household inequality, right? So when governments typically when they have designed the social protection systems, they target households. And even thinking about designing access to banks or opening bank accounts, right? So we have research that shows that when women have their own bank accounts and they're able to access that money from their own account versus money going into their husbands, it does lead to increased empowerment, right? And there's a randomized controlled trial around this. And now in this particular time, I think it's even more important because the other nuance here is that sometimes and overall the household may be a middle income household or may not come in the traditionally poor household, but there may be poor members within that not poor household who are typically women. So as governments are thinking about designing these systems, that is why universal transfers also I'm not proposing that that's the only solution, but where they do have an advantage is that you can target individual household members rather than targeting the household as a unit. So that's my very quick response, but I think this is something that we do need to take into account even when thinking about G2P payment infrastructures or thinking about other forms of transfers. And in fact, in the universal thing, there's also the idea of having transfers to children, and that should go to the mother's account. Because there's also research that shows that from a purely like an instrumental perspective, mothers do care for things like education, health, etc. for children in terms of spending. So I'll stop there.
Thank you so much. And you know, it is a very short and targeted answer, but I think that the field itself is vast. And even the point that Balash raised earlier in terms of gender implications, this digital divide is a huge issue in terms of how women are able to access, you know, digital technologies. Let me perhaps swing over to Gisela. One of the things that's coming out as well in this whole presentation and in everybody's talk is this idea of partnerships. We obviously need to work together. This is an unprecedented crisis. Can you say a few words in terms of your perspective on partnerships?
Yes, thank you, Joanne. Well, partnership has always been core to our approach in all the programs that we undertake. And therefore, when COVID-19 hit us, automatically, it's really a question of how do we now collaborate. With the civil society and private sector coming together, this is actually easily coming together. It's actually born out of decades of various agrupations that have been happening. But in particular for the national government also, we actually work with them significantly. In fact, I would say also that a lot of the partnership also happen around sharing of expertise. So you have real estate companies, architects building isolation centers for COVID-19 patients. So something that made it easy also for the government to undertake its own responsibility. But our focus now is to really help the local government units, because in a sense, they're really the ones in the forefront. They're really the frontliners in this whole battle, from tracing to treatment to ensuring their livelihood. And that's why what we're doing is to work closely with specific local government units and help them in developing data-driven decision-making, and also looking into innovations in service delivery, and more importantly, how we can also continue to mobilize resources for them.
Excellent, thank you so much. And one final question I'm squeezing here because I'm noticing our time. To Balash, perhaps you can give us a little bit further reflections. You know, from your perspective, has the COVID-19 pandemic actually worsened economic inequality? You've spoken about this digital divide. You've spoken about, you know, poverty being endemic. Are you seeing a worsening of the situation because, you know, some of the people in the richer quintile have more access to jobs? And what sort of social protection would reduce inequality most effectively. And perhaps while you're answering that, reflect a little bit on the universal basic income type models that are appearing, but are they really effective?
Okay, and you
It's a
want me to
lot.
finish this in 30 seconds, right?
30 seconds.
So I can't. It's a very good question. What I see is that COVID-19 started as a health crisis, and it very quickly moved over to the economic area. The economic impact is playing out still. And I actually believe that it will get worse before it gets better. So in that sense, there is definitely a whole lot that needs to be done. My view about basic income type measures is that they will absolutely be needed. But there was actually one question which I thought was a very thoughtful question, and that is about double dipping. What happens if someone gets already two kinds of social protection measures and now also gets a universal basic income? Isn't that a bad idea? And it turns out that this hinges on having a unique identifier for people. If you actually have unique identification for people, you can say, hey, if you have no other support and you are not employed, here is a basic income that provides a social safety net for you. But if you actually have others, if you ask for the basic income, you become ineligible for the other. So this is a way to prevent double dipping, and it can be done. I would like to refer to Pakistan's EXAS emergency cash program. It has been implemented. It's a basic income type measure. It has reached 17 million households. In fact, more than 100 million individuals. It was rolled out in 10 days. And it has done exactly this kind of support. If you don't have any other way of surviving, here it is. It needs to be worked out so that it can become permanent, but on a temporary measure, it was really very useful. Let me just say one more thought. This is one of those successes where success is defined by nothing much happening. People survived, life went on. And for this reason, it is always underappreciated because the counterfactual has not happened. Tens of millions of people didn't go hungry and didn't go really unhappy with the social contract. So this kind of silent success needs to be also appreciated. And this is something that works against governments, because governments do a lot of things and sometimes their success is embodied in nothing much happening. And it is very important to articulate that this is equally crucial. Let me stop here. Thank you.
That's an excellent point, Balash. And you raise a really crucial issue. Silent success. Just because we haven't had a crisis that had sort of doubled into conflict or something, doesn't mean that that social protection hasn't been effective. We still need to fight to kind of get full coverage, etc. But my goodness, we're doing well. That's essentially what you're trying to say?
We are doing good things, and we could do better, but we are doing good things. Governments are doing good things. Yes.
Very, very good. Our time has come to an end, and unfortunately, there is so much more that we could discuss. There's a lot more areas. We've had a panel that has such a rich amount of experience. And maybe just to summarize, let me just raise four key points. The first one is around digitalization. Social protection landscape is evolving, and we do have tools that will help us to really expand our coverage, improve our targeting. We've been talking about, specific individual identifiers. We've talked about, contactless payments. We've talked about ID cards. So the whole issue around technology is something that we really need to start leveraging. And I think that's an important takeaway from this conversation. Another important takeaway I think that I take for myself is the term fiscal termites. I love it. I think it's really important to continue to look at our national planning and budgeting processes and systems, making sure that we are squeezing as much value for money as we can from our public dollars. And so this does require a lot of political push and will behind it, but certainly there are opportunities for a lot of efficiencies to be made in the way in which we are allocating our budgets and resources. And of course, the point that Pak Amir mentioned about changing our policies and looking at longer term planning and strategies around that is crucial. Maybe another point to take away is around the issue of partnerships. And thank you so much, Tikisela, for really highlighting that for us. This is not something that governments are going to be able to do alone. And this is something that every citizen must take responsibility for. And certainly private sector and corporates can play a massive role and inject an innovation and dynamism into responding and rebuilding post-COVID. So I think those are my major takeaways here. Thank you to the panelists. Thank you for your insights and just sparking the incredible conversations. To the participants, you've sent through some really interesting and thoughtful questions. As Patsian said at the beginning, we will review all of the questions and give a written response. So don't feel that we haven't tried to touch on everything. We have just run out of time. So on that note, let me hand back to Patsian. Thank you so much, Patsian.
Thank you so much, Joanne, and a wonderful sharing from all the panelists. Just scratching the tip of the iceberg here in terms of the engaging conversation. We can see definitely from today's conversation that not only is there a need to evolve, increase data transparency, and looking at new communities that may be needing social protection post-pandemic, private sector partnerships are critical, and as well as government response to social protection that has to extend to all segments of society, particularly around small businesses who are very important anchors in local communities as well. And I think we've all now walked away with that very important term of fiscal termites. We thank you, Mr. Ballas, for introducing that to us, and why particularly addressing these termites and also other white elephants are important to create fiscal space for stronger policy response. So it is the beginning of a series of more conversations, as we mentioned earlier. And the next webinars will be taking place on the 30th of September, looking at the maximizing of potential of philanthropy as a response to COVID-19. And then again on the 30th of October, looking at the opportunities to further invest in a green economy in the post-COVID-19 environment. We would like to get your early interest in your availability to join the upcoming webinars on this poll that you can now see on screen. Please click yes if you can join our upcoming webinars. We'd love to see you. And then secondly, while you're taking a few seconds to do that, we hope that today's webinar also gives you an opportunity to consider whether there may be innovative solutions in financing social protection in your respective markets or arenas of work, where you can see an opportunity to further engage social investment and impact capital to work with you. If you do see these kinds of opportunities in your work, or you may already be working with other social protection schemes that can benefit from further collaboration with impact capital, we'd also love to hear from you. If you could then now look at the next poll that's coming up on screen and indicate yes if there are initiatives that you'd like to share with us so we can contact you to find out more, that would be very helpful. Again, if you have other forms of social protection or financing of social protection projects that you may be working on or are involved in, which could benefit from further conversations about the way that impact capital can play a role, please click yes, and then we will come back to you to find out more. While the rest of the audience takes a few more seconds to answer this last poll, we thank you once again for your enthusiastic participation. Please visit AVPN's website to see the materials that you saw on screen today, the recording of today's webinar, and also any other further response from the panelists to your questions. Thank you very much for your time and attention, and we look forward to seeing you at the next AVPN webinar. Goodbye, everyone.